The normal gait analysis system requires a quite big lab, which requires the most commonly used or more established system is the Vicon system, which requires about 12 digital cameras, is about, I think, 5-meter long lab and stuff like that, and it's very expensive. So as you can see that this kit is all included in this one briefcase, which includes a laptop and 4 sensors and obviously the software program to run it. Every green spike is your right leg movement and the blue spike is your left leg movement, and then in the end it gives you the further detail about every graph. First of all, we need to attach the sensors to the patient or subject. They are inertia-based sensors, and they record the movement, they record the angles at the knee, they record the strides. In the end, what we get is, we get the angles at the knee joint, we get the speed, get the stride, and that helps us to see how the person is walking. It can very easily be used on hip, because we measuring the angles with this kit at the moment. That angle can be measured for hip, for elbow, or for shoulder. So I think there's 4 major joints of the body. This particular kit in the current state can do that without any problem. We just need to alter and probably redesign our straps a little bit. I think the primary aim of using this system in London Knee Clinic is that we do the test before the operation, then we repeat the test a couple of times after the operations. We can monitor that progress, and we can advise the patient what area he needs to stress on in terms of improving his gait. The good about this is that because there are only few fully established gait analysis labs in UK at the moment, all the patients, especially the cerebral palsy patient or any patient who has significant gait problems, are being referred to those labs. And not only that's very expensive to conduct that test, but that labs are only at few places in UK, and the people has to travel to that particular place to get it done. We can take the kit to the clinic or the patient rather than taking the patient to that particular lab. I would say it's an analysis tool, but at the same time, any operation or any treatment patient gets is working towards the cure. So obviously it's helping towards it, but essentially it's an investigation and analysis tool. Considering that this particular kit is recently developed. When I say recently, it means that during last year or two, it has reached to its kind of final version. We need to conduct some more tests, and once we are happy that our software is suitable, this system provides reasonable essential information for a clinician, especially in orthopedic practice. I think, and it's very inexpensive compared to the full gait lab. I think it can be used very commonly in any hospital in the UK, and obviously it will reduce the cost for that particular hospital or the health services.